Hello everyone, hope you all are doing good. This is Dr.K.Jansi Rani, Assistant Professor and Head, Department of Nutrition and Dietetics, the Standard Fireworks Rajaratnam College for Women, Sivagasi. So today I am going to share you about the mechanism of ulcer. So before getting into the topic, let me now tell you what are the important key points and takeaway points you will be getting by completely listening to this video. So let's get into the video. So you will be knowing and understanding about the mechanism of ulcer, the formation, the way of formation and the causes, symptoms and what are the probable ways of getting ulcer by an individual by looking into this video. So let me first explain you about what is ulcer. So for introducing ulcer, we all must be undergoing, we call it as gut feel. So that may be called as ulcer sometimes. Ulcers are open sores that can occur in various parts of the body. Many of us misconsume that ulcer can happen only in the stomach. It is not like that. Ulcers are any open pores that occurs in any part of the body, such as stomach, esophagus, small intestine, etc. So that result from a loss of mucous membrane exposing the underlying tissue to stomach acid or digestive juices. So when the mucous membrane of the stomach or intestine which gets exposed to the strong acid which is being secreted by the stomach itself, it may end up in having ulcer. So there are some three types of ulcers. We can commonly call it as peptic ulcer, but when we look into deeper, we can understand there are duodenal ulcer, gastric ulcer and esophageal ulcer as well. So to get into the clear vision, we can now look into peptic ulcer. What is peptic ulcer? These are the open sores that develop on the inside lining of the stomach, which by reading you can understand which is the deep inside lining of the stomach. If gets affected, then it is peptic ulcer. So upper smaller intestine or esophagus, it is called as peptic ulcer. If the ulcerative pores occurs in the duodenal area and are in the duodenal passage, it is called as duodenal ulcer. They develop when constant pressure on an area of skin leads to skin breakdown and ulceration. This is often called as stress ulcer as well as pressure ulcer. So apart from this, we also have gastric ulcer, which is in the underlying portion of the stomach. We can have a source, ulcer source, which is called as stomach ulcer. So now we can look into the causes of ulcer. There are so many causes of ulcer. As a common man can know, ulcers are caused by the food which is not being taken in appropriate amount and appropriate spices. So apart from this, we can have some other causes for peptic or any kind of ulcer. For its case, it is when we come to know ulcer can be caused by the organism also. It is called as Helicobacter pylori, which causes deep infection and in turn end up in having a ulcer in the stomach area. And non-steroidal anti-inflammatory drugs. If you have been under drugs, unprescribed drugs for a very long period of time or very acute dosage of very intensive dosage in acute period, can end up in having ulcer as a result. And stress, mental stress, of course a significant cause of having ulcer. Smoking, alcohol consumption may also have a significant impact in creating ulcer in our body. And genetics. Finally, we also have the congenital causes that also can be a factor of causing ulcer. So first let us get into infection. So most commonly caused infections are Helicobacter pylori bacteria, which is a bacterial infection, of course. So medications, if you are in a medication for a longer period of time, you may have You may have ulcer in future if it is not taken with antacid. Proper antacids should be supplemented with the drugs of severe dosage. So, regular uses of non-steroid anti-inflammatory drugs, we call as NSAIDs, may lead to having ulcer. And of course, lifestyle factors. Nowadays, many younger generation people, adolescent people are having lots of ulcer problems. That's because of the smoking and excessive consumption of alcohol and stress, and another massive reason is the consumption of junk food and imbalanced diet. So, what is the pathophysiology of ulcer? So, first thing we have is mucosal injury. The initial loss of mucosal protection exposes underlying tissues is the first and foremost symptom, not exactly the symptom, physiology which is happening in the ulcer formation, and then inflammation. Response to the tissue injury, whenever it is common, whenever we get into contact of any injury, whenever we get into any injury, we will get an inflammation in a particular area. So, like that, when the underlying intestinal tissue, when it has exposed to the strong juices, it may get injured, and as a response to that injury, we may have swelling and redness inside the intestine, and which in turn, as a continuous exposure to the digestive acids, leads to the ulcerative formation as its consequence. So, we also have 3 protective layers to protect our system from the from the digestive juices, prostaglandin, mucosal layer, everything. Even after the layer of protection, if the intestinal membranes are getting exposed to the strong acids, there are no other cause, we end up in having ulcer formation. So, what is the symptoms of ulcer? So, one can have a burning pain and burning sensation in the abdomen even before and after the food as well, heartburn, regurgitation, bloating, nausea, which is vomiting sensation, and continuous bloating, abdominal pain, regurgitation, heartburn, very hard to digest feeling. Those are the initial symptoms of ulcers. How can we diagnose ulcer? The most appropriate way to diagnose ulcer is the endoscopy method, where we will be injected a camera inside our stomach through a tube to the mouth or through the nasal area. We can locate the area of ulceration inside the stomach. That will be the appropriate and perfect identification of ulcer. And upper GI series also, stool test. If you are having infective ulceratives, that is the ulcer caused by the bacteria, it will have its stains of bacterial disposers in the stool. So, stool test will help you in identifying the ulcer. So, what are the complications? So, if an ulcer left untreated, untreated or unmedicated, what will be the complication as a consequence? Hemorrhage. First thing is hemorrhage. As we all know, it is nothing but the blood leakage. So, risk of bleeding, internal bleeding in the intestine may lead to causing severe problems like anemia or blood, even it may end up in having blood transfusion if it is left untreated. Perforation. This ulcer is capable of having multiple holes, which we called as perforation, like it erodes the stomach and intestinal wall, causing hole in the stomach, which may end up in having cancer, obstruction, swelling or scarring in the passage of the obstruction in the passage of food can happen in the stomach. So, after all this, if ulcer is left untreated or it is getting worsened, it may end up in having cancer. What is the treatment? So, first thing, we have to treat it medically. we have to take prompt medicine, inhibitors, everything we have to give if it is an infective ulcerative thing, and then dietary changes. You have to avoid spicy foods, caffeinated foods, and as well as acidic, highly acidic foods like onion, garlic, ginger and all should be avoided. And even if it is not able to control the formation or the exposure of ulcer, we have to go for surgery if the complication is more like bleeding or perforation. So these are the treatment of ulcer. So how can we, so before getting into the problem, we always have to think of the prevention and management. So it is always better to prevent instead of taking medicines once it is occurred. So prevention is always better than the cure. So we have to avoid taking alcohol, and if you are a chain smoker, you have to stop smoking as soon as possible, and eating a balanced and a healthy diet without giving more importance to the junk and other sort of food should be avoided. And if you are in medication for a very longer period of time, you have to check with your dosage, and also you have to make sure you are not taking anti-inflammatory dosages for a very long period of time, or if it is unavoidable, you have to make sure you are taking it with an antacid, with a proper antacid. So stay hydrated is a key in preventing ulcerative. Drink as much of water during the day, especially during the summer season. And stress, which is a predominant cause of cancer in recent days, you have to avoid being stressed and tensed for a long period of time. Take some relaxation techniques and have a therapy for depression or stress. Seek prompt treatment for the symptoms. By cutting down the symptoms earlier, we can prevent ulcer as well as the consequence of ulcer ending up in stomach cancer or any other serious health issues. So thank you for the patient listening. Thank you.